Okay, so I'm going to show you the sacral stone now facing down, prone position. We'll do it with the clothes, don't worry about that. It's more, it's not so, well, the process of taking it from the slow cooker would be the same. The only difference is the position on the body, yeah? And we'll need to talk about it first. Now you see that the back morphology on certain people would be different. Also the stone size is different. Sometimes putting the stone on the lower back would be fantastic because it allows you to relax the muscle, warm them up, and you work in other area and the stone there just prepare the area for you to work on. However, if the stone is too big, then especially with people who have back pain, might not be great because it would just increase the lordosis too much. Few things to do. Either, if you have this situation, either put pillow underneath the abdomen, and what you do that's stretching the lower back, or use the largest of the large effleurage stone instead. And you can play it in any way. So this is the lower back. The upper back, you may want to put it, however, some people having the kyphosis, and it's quite dangerous because if this fall downhill, you don't want to do it. So I'd never put it on the upper back and the middle back. I would just put it on the lower back. Yeah, would I love it to have it on the upper back? Yes, but I don't want to take the risk really. Yeah? So the only other place you can do is on the sacrum. Yeah? And that's really good. Sacrum is an area that we usually, I think that we don't work enough on that. I do a lot of knuckles on the sacrum. You know why it's good to work on the sacrum?
Too many muscles get tied up to the sacrum.
A lot of muscle coming and attached onto the sacrum. Iliotibial, erector spinae, QL, glutes. Yeah, kind of, there are big muscles. So when you're working on that, and you know, have you heard about multifidus, muscle that's called multifidus? It's part of the erector spinae group. Even on the tendon of that muscle, you still have muscle. So what I'm saying is that the distinguish between tendon and a muscle sometimes is not 100%. You have a little bit of a muscle in the tendon as well. Yeah? Mm-hmm. So I know that when you're having the holistic diploma course, you're thinking that's a tendon, that's a muscle, but even in a tendon or a ligament, you will have some muscular tissue. Yeah? Smooth muscles mostly. So it's nice to work as well on the tendon, ligament, and some muscles that adhere onto the bone itself. Okay, so let's decide that you're doing it on these two areas. Okay, so the application of it is pretty much the same. Yeah, you're preparing that. I can do it on a double fold. Yeah, taking the tongue. What I've seen when you're taking the tongue, when you're taking the big stone, if the big stone is further away from you, it's not a problem. If it's close to you, then you might want to even rotate it, and then what you do, you build the rest there, and then you take it, or you take it from the opposite side, from this way, yeah, and then you need to turn it again into, yeah, into this position. Yeah, just be sure that the tongue hold it well. Yeah, and then really nicely leave it here. Okay, then you roll it. I think that should be enough. Again, you be sure that the client is waiting for the feedback from the heat of the stone. So you'd say, I'm going to put the stone here. Yeah. Let me know if you feel too hot in a few minutes. Okay. You would have another towel here. You put the stone here, and then you really ask them, lift your hip for a second. Thank you, and down. Good. So it's stable. If I start to do more mobilization, the stone would stay there. Yeah? Even better, what you could do is really create a nice pocket here. And then you put the stone. Is it all right, the place? Yeah? And then you see it's quite stabilized. And then lift the hip, put it up and down, please. Yeah? And it might stay for half an hour. You're ready for your back. You're ready for your leg massage, arms, whatever you want. And then when you're ready to turn, you just turn. Okay? Do you think you want to practice it, or we can move on? Yeah? Okay. The only thing, when you're watching the video, just be sure that you start on the sacral and then you see if the lower back works for them. If it's not, don't put it there. Yeah? Put just nice large effleurage. Even, you know what, put two small effleurage. Wrap them and just put one on each erector spinae. Yeah? That can work. Fantastic, good. Very hot. Should we stop that video?